Elbert County Board of County Commissioners meeting today for January 22nd, 2025. Before we get started, I've asked our clerk and recorder, Rhonda Braun, to lead us in prayer and the pledge.
Good morning. Dear Heavenly Father, I just thank you for this time that we have together, and I ask for wisdom for our elected leaders, and that all that is done and said would be pleasing to you this morning. And I thank you for our first responders and our public servants that give so much, and I thank you for protecting us with this cold and this weather, Lord, and I just ask that everything that is said and done would be honoring to you today. In Jesus' name, amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I call the meeting to order at 9:01. Emily, will you call the roll, please?
Commissioner McDaniel.
Present.
Commissioner Schroeder.
Here.
Commissioner Buck.
Here.
Okay. Gentlemen, we have an agenda before us. I would entertain a motion to approve the agenda as presented.
Make a motion to approve as presented. Second.
A motion and a second to approve the agenda as presented. All in favor, please say aye.
Aye.
Aye. Our first order of business is item D for the organizational meeting. And before we even get into the meat of the organizational meeting, we need to have a discussion selection of the chair for the coming year. If there's any discussion or motion, we can take that at this time.
I would like to make a motion or a nomination for Byron McDaniel to be the chairman. He has a servant's heart, extensive background in public service, a very strong resume. I've seen it. I think the county is lucky to have him.
We have a motion for Byron McDaniel to be chair for the county commissioners. Do we have a second?
Second.
Okay, we have a motion and a second. Is there any more further discussion? Before I take the vote, I just want to say I'm a little disappointed with the way that this has turned out. Not that I won't be chair, but in the way that it has gone about. I was not informed until 10 minutes before the meeting of the intention for this to happen. Obviously, there's been conversation, there's been discussion and decision being made outside of this meeting between two commissioners without the presence of a third one. And what I have learned over the past 12 years, watching and sitting in this chair for the past 2 in the clerk's office for nearly 10, is that this board has to have trust. This board has to be able to trust each other, have good communication, and this seriously dampens that trust factor. And so with that, I will call for a vote. I would like it to be a roll call vote, please, Emily.
Commissioner McDaniel.
Aye.
Commissioner Schroeder.
Abstain.
Commissioner Buck.
Aye.
No comment on this one.
So a couple of comments that I'd like to make. This is not, maybe you think this was underhanded or whatever, but that was certainly not the case. These were decisions and discussions that we made yesterday, and you were tied up. We were here till 6:30 last night. We were on the phone. We made some last minute discussions about moving this forward, and it was our opinion that due to the litigation that's pending in the county right now, that this would be the best course of action. So if you're offended, then I'll offer an apology for that. And with that, I'll move on. discussion and selection of vice chair of the BOCC. And with that, I'll entertain a motion here. We've nominations at this time. Any nominations? Okay, I'll nominate Mike Buck as the vice chair for the BOCC. Is there a second?
I second.
Dallas? Okay. All in favor?
Aye.
Aye. Motion
Abstain.
carries. Next item is discussion and approval of the organizational meeting for 2025 appointments and reappointments resolution. You have your list, Mike?
Oh, yeah.
Yeah. So we've looked at the operation and we've discussed with Dallas the hours of operation. Section 3010 of 109 CRS hereby designates all county offices to be open. So we basically, to cut through the chase, here, we're going to continue with the business as is Monday through Thursday, 7:30 a.m. to 5 p.m. except holidays. However, all clerks of the county court, the county sheriff, sheriff's departments, all be subject at all times to the command of the people, and each therefore shall at all hours, nights, and days be prepared to attend such duties as may reasonably be required. Our regular meeting schedules, in accordance with section 3010-303, hereby designates the second and fourth Wednesday of each month in the Commissioners' Meeting Room on the second floor of the Elbert County Administration Building, as it is regular meeting time and place, subject to change as needed to accommodate the operational needs of the county and as may be designated in posted meeting notices. Number 3, designated posted places. In accordance with section 246-402-2C of the CRS, hereby designates the county's online board information page, and it's in here, I won't read that, as the designated place for posting of notices and public meetings. Is there a motion to accept?
I'll make a motion that we accept Resolution 25, organizational meeting, 2025 appointments and reappointments as read.
Second.
All in favor?
We have any discussion?
No discussion. In favor?
Aye.
Aye. Motion carries. Consent agenda. We have approval of CDS milers as needed. Is there a motion to approve that?
Mr. Chair, we usually take the motion to take the entire consent agenda at one time for sake of time.
Well, I understand that's how we normally have done it in the past, but I understand that there's maybe some questions involved in that. Mike, do you have anything you want to bring up on that?
I don't.
Okay.
If you want to take them individually, we can do that for this meeting, and then you can decide the best way to proceed.
I know there was some discussions about a couple of issues there, but we could do that. All right. Is there a motion to accept the consent agenda?
I'll move to accept the consent agenda as presented.
Second.
All in favor? Aye.
Aye.
Board of Health. Quarterly Board of Health update. Okay. We need to talk about the issue in Agate right now. I know that they're tied up with that this morning.
Ken?
So just for your knowledge, that we've got a serious water issue in Agate right now. The water lines from the tank to the pump are frozen. And so our OEM, Department of Health, are out there working on that along with the town of Agate. And we're in close contact with them about that. As of this morning, there's been no change. So we're closely monitoring that and working with them, and we'll offer support to Agate as needed to get water back. So this affects the drinking water. The fire service out there is aware, and we have neighboring fire stations that are also aware with tanker trucks in the event that we have a fire, something of that nature. So we are on top of that, monitoring very closely. Next item on the agenda is elected officials, department heads, and staff reports. We have any department heads here or staff that would like to make a report? Okay. Next item is citizens' public comment.
Good morning, Commissioners, and welcome aboard. Two things I'd like to speak of, especially the first would be the tension that's in the room right now. Communication to the public is paramount to what has to happen. A unified force, I mean, you can have disagreements because that's why you're all three there, you have to vote. But the tension in the room, we hope that we can mend and start moving forward from this point on and have a discussion of that. The real reason I'm up here is last week you had an executive session where you were brought up to speed on what the Excel project coming across the county is to bring. Understand you can't speak to that, but from the landowner's perspective, Excel is still moving forward. They're forcing each and every one of us to get lawyers because they haven't actually said eminent domain legally. They talk about it all the time, but they have not actually submitted anything to our lawyers or to us personally about eminent domain, but that's where this is headed. If we're not going to sign their agreement, they're going to use eminent domain to take the properties that they need. That's just an FYI for you guys to bring you up to speed on where we're at with that. And hopefully we'll get some more information as we move forward from our side legally and from your side legally. Thanks for your time.
Thank you. Any other public comments?
Good morning. Excuse me. Good morning, Commissioners. My name is Robert Rowland, 1891 Pawnee Parkway, Elizabeth, Colorado, 25-year resident of Elbert County. I'd like to welcome the board, all three of you, and to kind of mirror the previous gentleman's comments. Clearly there's stress in this job. There's moments of tension, there's moments of joy, and there's moments of regret. Lord, don't I know. But I would just encourage all of you in this moment to push forward and recall and remember why you're here, who elected you, just like we did in our nation recently. We are looking at a new era, and the people made that choice. And I think it is incumbent upon all of us as elected officials, and it's easy to forget sometimes. Again, Lord, don't I know it, that you're here at the calling of the people, and there's high expectations, and we want to welcome you. We want to share that we understand sometimes that it is a difficult job, and don't take it personal, but the people have spoken, and we are glad you're here, all three of you, and pray that you will find a way to serve the people as they intended. So welcome and thank you.
Thank you. Any other public comments? Well, I'm just going to say one more time that publicly I will apologize to Dallas, and I was on the phone with this morning trying to get this update with Agate Water. We should have had discussions days ago. It's been discussed back and forth some time, but yesterday was a day that we made a discussion and was here to 6:30 last night, but I look forward to working with Dallas. We're going to work together and we'll mend this, and some way we'll earn Dallas's trust, and we don't want to start off on the wrong foot here. So we'll move forward, do the right thing. So, all right, any other public comments? Okay, moving to item I, discussion items. Are there any discussion items? Having none, move on to the next item. Action items, fourth quarter 2024 Public Trustee Report.
Good morning, Commissioners. Sherry Hewlett, the Elbert County Public Trustee. Statutorily, I'm required to submit a quarterly report to the board. I keep track of these numbers on a spreadsheet, as you see there before you. And at the end of the quarter, whatever excess funds that are left are transferred to the Public Trustee Fund 35 until such time at the end of the year the remaining excess funds are all transferred to the general fund. So at the last page of my report, you'll see $11,969.92 being transferred to general fund or Fund 35. And July 1st of this year, the public trustee fees doubled. So what that means is any foreclosures that are started, all of those fees doubled. A lot of the smaller counties in the state of Colorado don't make their salary because the fees are not substantial and they don't have a lot of foreclosures or release of deeds of trust. So that was one statutory change that was made so that those smaller counties can at least make their salary as public trustee. The salary or the public trustee's office is separate from the county, any other county office. It's a self-funded department. So in order to get paid, you have to make your fees. Fortunately, in Elbert County, we haven't had that problem. So that's a good thing. I anticipate with the doubling of the fees in July that I'll be transferring a little over $11,000 to the general fund. It's kind of detailed and you may or may not, Dallas understands it, but I'm happy to go over how that works independently of this meeting at some point so that you kind of have a better understanding for the two new commissioners if you don't. So anyway, on the foreclosure side of it, most of the fees, we get a deposit from a foreclosing attorney. A lot of those fees that are charged are pass-through funds. So I don't pay for it, but the foreclosing party does. I do make some fees on some of it, but most of it's pass-through, if that makes sense. Okay? Do you have any questions or comments?
No, I mean, I understand it. I don't.
Okay.
Well, I'd like to say thank you.
Oh, thank
I
you.
appreciate the 11,000 back into the general fund.
Yeah.
That's always a good thing to see.
Yeah, every little bit helps.
That's right.
So, you're welcome. I think I'm up next, so.
Yeah.
Okay.
I'll make a motion that we approve the fourth quarter 2024 public trustee report as presented.
A second.
All in favor? Aye.
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 Okay, thank you.
I think you're up next for the cancellation of uncollectible tax assessments.
Yes, sir. So now I'm the treasurer. Every year when we're unable to collect taxes from a year ago. The assessor, Susan Murphy, and I work really closely on this endeavor. She discovers properties, and when she discovers that they're no longer functioning or not there, in the case of a mobile home, she will let me know. So I can take a look and see, you know, if there are any taxes due or not. If you look at Exhibit A, we have a lot of oil and gas properties that were either in bankruptcy or were deactivated. When it comes to oil and gas, if they're producing, I can contact the first purchaser to try to collect the taxes. But as you can see, with the personal property part of that, they're deactivated and there's no production. So it's a big number this year, unfortunately, but we've been working on these specific accounts for a few years, trying to get them collected, and it's just not going to happen. Our theory as far as distraining the property when it comes to oil and gas equipment, it's very dangerous. You may or may not have a different opinion on that moving forward, but if we distrain them, we have to store them or sell them, and so that can be problematic, and just to get them out of the ground could be dangerous. So that's the reasoning behind that. This mobile home that's on here is exempt because it's under the $28,000 value. Let me look at that one closer here. Yeah, it's an exempt mobile home, so there's no taxes are due. I don't even know if it's livable, to be honest with you. So
what's your recommendation? Just leave it?
Right. We'll just write off the taxes, and again, Susan and I will keep discovering these items and try to collect what we can. And this is a big one this year. It's typically not like this. But again, as I stated, we've been working on the oil and gas properties on this report for several years. And it's beyond collection at this point, unless I said, like, if you wanted to distrain the property, you could do that. But we've not, ever recommended that when it comes to oil and gas personal property. Yeah. So, any questions on that? Okay.
I don't think so. Nope. Thank you.
Thank you.
Mr. Chair, I make a motion that we approve Resolution 25-TBD, cancellation of uncollectible tax assessments.
Second. Is there a second?
Second.
All in favor? Aye.
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 Thank you.
Next item's board planning.
Mr. Chair, I believe we have representatives from the Public Health Department. We could do our Board of Health meeting now if you so desire.
Certainly. You just walked in, so Public Health, would you like to have any comments?
Mr. Chair, I move that we open as Board of Health.
We need a motion for that?
Yes, we do.
All right. Motion?
I make a motion that we open as the Board of Health.
Second. All in favor?
And just to clarify, I believe we had a motion and a second to open. I don't believe there was a vote to open.
All in favor?
Aye.
Aye.
Yeah, thank you. That's what I'm interested in. Yeah, if you want, if you feel comfortable doing that now, that'd be great.
Absolutely, I'm comfortable with it as long as you guys are.
Yep.
So a situation arose last night. I was called last night to let know that Agate Water has an issue with their water. So I spent lots of time on the phone with the water representatives with Agate Water to figure out the situation and what's going on out there. So they had the system down, it sounds like for 3 to 4 days to make a repair on a valve. And during that time, there was a freeze in the line and they are no longer getting water into their distribution tank. From my conversations both last night and this morning, it sounds like they have at least 1 day of water in their tank right now. We're taking measures to get water out to them and to find a truck that's reasonably cost effective to bring them potable water to keep those tanks refilled, as well as bringing water back out to the families that are on that district. They're currently issuing a conserved water notice to the community right now and contemplating closing the school to reduce that water consumption as well until they get flow back up and running, so they're not having to bring more and more water in to replenish the supply that's in those tanks. They have been in contact with CDPHE, but still are seeking guidance as far as any recommendations that the CDPHE Water District team has to give them as far as tank and quality going forward that way. Excuse me, so at this point, they still have not reestablished flow because it is not supposed to be above 30 degrees till Friday. I'm anticipating it might be potentially Friday before they get flow going again. He's still out there working every day, all day long trying to get that flow going, but we're still without anything. So I have plans to touch base with them this afternoon, and they're going to call and update us if the situation changes, but we'll be getting water out to them and trying to help support in any way we can. Any questions that you guys have regarding the situation out there?
Just a comment. I had a phone call last night from an individual who has some water trucks sanitized
Okay.
for transportation. And so I can get with you after this meeting and put you in contact if you need that.
Perfect. Maybe email me the contact information for them. Right now, Juliet, who's with Emergency Management, has been in touch with someone from Fremont County, as well as Arrowhead Water that sometimes does the work pro bono. So that's our next step as far as getting that water transported potentially.
What about El Paso County? I understand they have.
They had a water tank. She hasn't been in touch with them, and I haven't heard any feedback on them. We got a lot more help from Fremont, and
We just need to make sure we don't contaminate.
Exactly. Theirs are potable. They're strictly designated for water. One of them would be through Arrowhead Water Distribution Company, so that one would be covered. And then the one that the emergency management coordinator with Fremont County has is only a 550-gallon tank, so that doesn't help us long-term, and it's going to be a lot of trips to do it. But he made himself available to us as well and said if we have need of him, just let him know and he'll be up. But if we can get Arrowhead to do it without a huge cost, they are the only ones we found that's willing to bring a tank and not be adamant that they're supplying the water itself. When we talked originally, they have an agreement with Deer Trail, and Deer Trail has agreed to provide them the water, but we need to find a way to get it there. And then once we get it there, we also need to find a way to get it into the tank, which means a 50-foot hose that would be capable of getting the water safely into the tank as well. So that would be the second barrier that we're addressing with these water companies.
And then as we discussed, just for the record, the fire department's in that area with their tankers and so forth, I believe.
Yep, they're aware, and it sounds like there's a branch that potentially, if they could bypass the line, if the line continues to be an issue, that they would still be able to pull. The pump is functional, it's just that the pump is not able to get the water from the well to the tank.
Okay. All right, and what about, as we discussed, what about getting bottled water, so forth out there that would?
Yep. That's where we're going to come in. So our first reach right now, we're reaching out to Walmart and Safeway to see if they have an emergency program that they'd be willing to donate it. Otherwise, Road and Bridge has very kindly agreed to purchase some and get it out there for us if need be. That we'll have out to them by hopefully noonish today, depending on what we find from Walmart and Safeway. Obviously, if it's closer, we can get it there quicker.
Yep. And then Monty, I know you've been heavily involved in this. Thank you. It's a real crisis, and we appreciate that.
And a big thank you to Monty for getting us involved as well, because I don't think they would have reached out to us if Monty hadn't alerted us.
Yeah, that's good. Okay, thank you.
Okay?
All right. Well, I'm sure you'll keep us, the board, in
Absolutely.
every step of the way with this.
Will do.
All right, thank you.
Yep. Okay, and to start my Board of Health slides for the last quarter of 2024. What I'm just going to talk about today is just kind of our staffing updates, bring you guys up to speed on the Public Health Department, the programs that we have, services that we're offering to the community, trainings that are going to be upcoming from CDPHE for the Board of Health, which is you guys, and I will help walk you guys through those when it's time, and a method for the public to report a concern if they have anything. So our staffing currently, I am the acting public health director. My name is Sarah McIntosh. Our environmental health specialist is Marissa Ginger. She's taken over recently for our previous one who retired in September. Lisa Helseth is our health educator, and I apologize, I missed her last name on the slides. Our administrative assistant who takes all phone calls and handles anything coming into the department is Iris. And Teresa Klaus is our finance and grant manager. Currently, we're sharing her 50-50 with human resources, or with human services that manages their program, and we're planning to transition her to 90-10, 90% human services, 10% us as of April, when she'll be taking on more of a role with them. We currently have 2 nurse practitioners practicing with us. Lori Coring, who is our pediatric nurse practitioner, in 1 day a week. She can see patients for well visits, for sick calls, for immunizations if that's what they're needing, or minor injuries. And Dawn Newbury is our family nurse practitioner, and she can see everybody from infants on up, all the way up through adults. She also is certified in DOT, so she can do DOT exams for anybody that needs a CDL exam, as well as, like I said, well and sick visits. Currently, we are in search for our new medical director. The one we currently had just retired, and so he gave us his resignation, and we've been in the process of searching for a person to fill that role. It is a minor role, it's a contract position, because I do not have a doctor. So with that doctor, it's a small fee with potentially up to 15 hours of service that they would offer to us annually on a consult basis. So we are posting a position and getting that one filled. And then we currently have 2 per diem environmental health specialists. Stacy Reinhardt is the one who just recently retired, and then Gary Hartzell retired prior to that. And they both fill in to help fill the needs when Marissa needs a vacation, or if she's out for classes or anything else that's going on. So she can help make sure that the service gaps aren't existent. So updates on our primary care clinic. So these are our 2 nurse practitioners and some of the services that we offer in-house. In addition to the services that they offer as far as medical treatment and access to care, we also contract with both LabCorp and Quest, so that if people have primary care docs that they work with outside of our practice, they can bring their lab orders to us and have their blood work drawn and sent in, so they're not having to drive to town to do that, in addition to all the other medical services we offer. Here's kind of a quick list of those. Like I said, the medical CDL exams, we do both for county employees and people working in the general public for any of our other companies that need folks with CDLs, including schools, which would cover bus drivers as well, so that they can get those done with us. We do drug and alcohol testing if they need it for pre-employment purposes or post-accident purposes, and we partner with HR to do that at a discounted rate for the county as well. Like I said, primary care well visits, but we also see folks usually same day for sick and minor injury care as well. Immunizations, routine screenings, and as I mentioned, blood work. So here's kind of some updates. The clinic is a new service that we started offering at the end of 2022. So we didn't start seeing any revenue in that department until 2023, but these are some of our clinical statistics from kind of what our revenue looks like, total appointments that we're seeing, who we're treating, and some of the basic services that we're seeing utilized. Before I move on, since I know there's a lot on that screen, any questions on what's there?
Yeah, real quick.
Yeah.
Could you look, where would your fee schedule be for some of these tests? Is that on the website?
We don't have it posted on the website, and it depends. I was going to say what we do is we bill insurance. We contract with most major insurance companies, Medicare, Medicaid, United Healthcare, Blue Cross Blue Shield. So it's hard to say because that depends on what insurance coverages are, but we work to make sure that people aren't getting high out-of-pocket.
What if it was cash pay?
Cash pay typically will do $20 for a visit, and depending on which lab work, because like I said, some people want a full panel, some people just want basics, but we always disclose that before based on what they're needing. Typically, it ranges between $20 and $100, depending on some of the more complex testing.
Okay. I just saw the revenues, and I said, well, what are some of those fees that generate that revenue? So I wanted to follow that path a little bit and see where that was.
Absolutely, and right now, like, for example, the other thing we're doing, because a lot of insurance companies don't cover sports physicals, so we offer those at a flat rate that we advertise at $20, I think, right now, for those. So, like I said, we try to make it reasonable for folks that either don't have insurance or don't want to use their insurance, if that's the case as well.
Yeah, okay, thank you.
Yep. The other thing, we did one on-site clinic last year, and we're working to work with the schools this year as well during the summer to get some of those sports physical clinics at the schools so that families can do that there and we can hit more of them and get that taken care of. So this is kind of a trend just to see where our clinic visits have been over the last couple years. Obviously, the big red lines have been what we've seen in 2024. And currently, like I said, we've only had each of the providers there 1 day a week. I'm hoping as we build those services that we can start getting those providers in and increase some of the services and times that those are offered. Moving on to our on-site water treatment services, which is managed by our environmental health specialist. These are some of the basic numbers as far as permits issued, trended out annually so that you can see those numbers. They've been pretty stable in the last couple years. We did have a jump actually in 2021 in the number of permits that we were issuing. At that point in time, more people were doing repairs and improvements on their homes, and so we saw the numbers jump a little bit, but they have been dwindling a little bit in the last couple, so we'll see where they trend out to moving forward. And just to specify a little bit so that bring you up to speed. So the new permit type is anybody that's building a new system. Repair is if you're repairing the existing one, and the use permit would reflect anybody when they're selling a property. So that would be the permit that's issued when the property is changing hands. Just for your knowledge. Here's a list of the different inspection numbers that she's been out doing, and this compares month by month for the last 5 years or 4 years. So you can kind of see where those numbers trend. They've been pretty on track with where our permits issued have been as well. And typically we do see higher numbers in the summer, spring, summer, and fall. They do in the winter slow down just a little bit. And for notes for anybody that follows our previous Board of Health slides, when I was reviewing our older slides that my predecessor was using, I noticed a discrepancy in what was reflected in eGov, in our budget, and through the assessor's office, and what we were reporting on our slides. It actually worked in our favor that the numbers in our spreadsheets were lower because we were missing some of the collected revenue from our licensed installers when they were getting their licenses through us as well. So this brings us up to date currently with what is reflected in eGov and AutoAge. So, and you can say the food license revenue is what we do to license our commercial food establishments. That's been fairly stable over the last few years. And then OWTS revenue, like I said, with the number of permits issued and the number of work that's being done, that has drifted down a little bit, but not significantly. One of the other programs that we've brought into public health is our vital records issuance. We brought that back in 2021, which is why we had a couple years where we didn't offer that services. So that's us printing birth certificates and death certificates for anybody in the county. It also includes folks that come out. Anybody in the state of Colorado can have one issued with us as well, as long as they were born in the state. But those are where our numbers sit. We have been growing that program a little bit year to year. So those are the total number issued for the year, and then that's the total revenue that that program generates. Updates on kind of our health promotion. This is what our health educator has been working very hard to accomplish. In our community health needs assessment and our health improvement plan, we've identified mental health as being a very big concern in the community and offering that support. So we've been partnering with CSU Extension as well as the Elbert Christian Church to offer some services and get folks trained in resiliency. So we have mental health first aid that happened last weekend. At Elbert Christian Church, we've been working with caregivers and emotions and programs to establish resiliency with both our adult population and our child population. Oh, thank you. Perfect. When are we rescheduling for? I don't know yet. The mental health first aid. So I will update that as well. I was going to say, please feel free to reach out to me if that's something that you would like to attend, and we can get you information on that guy. Sorry, I'm flipping through slides. We've also been working really closely with Pines and Plains Libraries to build a community coffee and chat program, mostly just as an opportunity to bring folks together, give them an opportunity to socialize, get communications open, and get that community support running. And then conversations are going to be the fourth Thursday of every month between 2:30 and 4:30, and they're open to anybody that would like to attend. And first one's tomorrow, and then the topics are listed below. Sorry, Lisa, I should have let you present this one. So the other thing we offer for the community as well, we host a quarterly blood drive here on the premise at the fairgrounds. So last year, for anybody that donated with us, we hosted at the exhibit building, but due to, it's a little bit more comfortable, so we moved over to the ag building this year. So we have our next drive coming up April 25th. They do have a link that you can schedule and get your appointment set up in advance if you like to do that. Otherwise, they do take walk-ins as well, and they're here between 10 and 2 on those days. So please come
About
donate.
advertisement, are we gonna get something out?
Yep.
That maybe put on our website as well?
Absolutely. We keep it on our website, and we keep it on our emails as well, but I can get a copy off to Amanda that she can distribute. And previously, what we've done is allowed employees to go donate on company time if that's approved by you guys as well, to increase those numbers. So, and there is potential that if we get more folks coming, we can increase the number of slots available or potentially bring them in more often if need be. Here's another slide on the blood drive dates. Again, there's the blood drive code here on the bottom that you can use to register. If you have any questions, please feel free to give us a call. We can help get you linked to their website to get signed up. This is our program with CSU on resiliency and suicide prevention. They're working on setting up some billboards potentially across the county to help increase folks feeling comfortable reaching out. Legacy Film Festival is one we hosted over the summer, and it's a video that you can actually watch on YouTube. If you have access to the actual slides, that is an active link. You can pull that up and watch that video there if you didn't get the opportunity to come join us for that day. And last but not least, I was going to say CDPHE is coming up with the Board of Health training platform through CoTrain. I know you guys have a lot on your plates to learn, and it's not available yet, but I will be reaching out to you. We're expecting sometime in February with instructions on how to get in, how to access the program, and how to go through. I believe there's 4 modules to go through that we can get you guys updated on as well. So look for that email to be coming from me, and I will be taking it as well, so I can help with any questions you guys have.
And that's an annual training.
It's an annual training. Yep. Last but not least, I was going to say, obviously, we are an open department. Please feel free to give us a call if you have any questions or concerns that we can help you address as far as community safety. But also, we encourage folks to use the report of concern so it's tracked that way, which is a link to the county reporting website as well, so that we can get your concerns tracked and routed to the appropriate department if there's anything that comes up. Those are some examples of reasons why you might want to call. And then last but not least is my contact information for anybody that has questions.
I've got that number program, so we'll be talking a lot.
Speed dial, you got it.
Absolutely.
So,
Well, Sarah, that was a very comprehensive presentation. I appreciate it.
absolutely, my pleasure. Any questions
No more
from you
questions.
guys, from the community?
I'm sure we'll be talking later today.
Absolutely.
Thank you.
Absolutely, thank you guys so much, and I apologize for the delay in getting started today.
Completely understand. Okay, we'll move on to the board planning.
We may want to officially close that,
Okay.
Board of Health.
Motion to close.
I'll make a motion that we close the Board of Health meeting.
Second.
All in favor?
Aye.
Right. Motion carries. Moving on to the board planning, under K of the agenda. So are there any agenda items for the next meeting? Okay. Workshop study sessions and pending hearings. Bart, do you have any comments on that?
As of right now, I don't believe we have any anticipated workshops or study sessions at this point. It is feasible that something could come up, and we could certainly have an agenda meeting or an agenda put together in time for that to be an issue. But at this point, I'm not tracking anything that we need to do that on.
Okay, thank you. And next item is land use hearings, 1 p.m. So we can recess until that time. All right, is there a motion?
I'll make a motion, we recess until 1 PM for the land use hearing.
Second?
Second.
All in favor?
Aye.
Aye.
All right, we're officially in recess.